Hi guys, I'm Dr. Monisha. Welcome to One Question at a Time series. Let's move on to today's question. Today we are going to talk about a triangle related to a heart. Any guesses? Okay, the triangle is described by Walter Koch. So we are going to talk about the Koch's triangle. Okay, the Koch triangle, which is a landmark for the presence of atrioventricular node, which has many clinical aspects. We'll see about it. So, today's question is boundaries of Koch triangle is not formed by A. Tricuspid valve ring, B. Coronary sinus, C. Tendon of Todaro, or D. Limbus fossa ovalis. Let's see a little bit about Koch triangle. Okay, so here is your Koch triangle, which is the landmark for your AV node. So anteriorly, the boundary is formed by the tricuspid valve. The tricuspid valve has three cusps, as the name implies. So which part of the tricuspid valve? The septal leaflet of the tricuspid valve. The septal leaflet of the tricuspid valve is going to form the anterior boundary. The posterior boundary is formed by the coronary sinus. You can see here the coronary sinus here. Okay, the posterior boundary is formed by coronary sinus, and the superior boundary is formed by the tendon of Todaro. The tendon of Todaro is nothing but a fibrous extension. A fibrous extension from the central fibrous body of the heart to the eustachian valve of the inferior vena cava. Okay, we have a fibrous skeleton of the heart. Yes or no? The basic structure of the heart is formed by the fibrous skeleton. So, from the central fibrous body of the heart, we have a tendinous structure to the eustachian valve of the inferior vena cava, and this structure is called as the tendon of Todaro. So, anteriorly it is formed by the septal leaflet of the tricuspid valve. Posteriorly it is formed by the coronary sinus, and superiorly it is formed by the tendon of Todaro, and within which is lying your AV node. Okay, so this is not it. One another picture showing the boundaries. Like I said, the anterior boundary is formed by the septal valve, septal of the septal part of the tricuspid valve. The posterior boundary is formed by the coronary sinus, and superior boundary is formed by the tendon of Todaro. So the hypotenuse of the triangle, okay, anterior boundary, septal leaflet, posterior boundary is formed by coronary sinus. The hypotenuse of the triangle is formed by the tendon of Todaro. Okay, the hypotenuse of the triangle is formed by tendon of Todaro. Okay, so what is its clinical importance? Okay, so AV node, as we all know, be it sinoatrial node, AV node, or bundle of his, whatever it is nothing but modified muscle fibers. Okay, it is nothing but modified myocardium. So how will you identify exactly where the AV node is? We have to identify the triangle of Koch. So with respect to AV node, the most common condition for which it is used is AV nodal reentrant tachycardia. AV nodal reentrant tachycardia, for which specifically the slow pathway of the AV node must be ablated. Slow pathway of the AV node. So within the triangle of Koch is here some part of the AV node, and near the apex of the triangle you have some part of the AV node. So you have to ablate the part within the triangle for AV nodal reentrant tachycardia. So if you are not knowing the boundaries properly, by mistake if you are going to ablate the entire AV node, what happens is it will result in AV block. Okay, so that is why the identification of the Koch's triangle is very important. Now as you can see in this fluoroscopy procedure which was done before, nowadays 3D mapping is available, During the fluoroscopy procedures, you can see the catheter coming inside the right atrium through the inferior vena cava. So, as it enters near the coronary sinus, they will be able to identify the boundaries, the triangle of Koch, and so they will be able to selectively ablate the slow pathway of the AV node, okay, for the AV nodal reentry tachycardia. So this view is your right atrium. Okay, you can see the rough part, you can see the smooth part, and you can see the tricuspid valve. Okay, and in the smooth part you can see the limbus fossa ovalis. So limbus fossa ovalis is not a boundary. So coming back to the question, the boundaries of Koch triangle is not formed by the tricuspid valve ring forms the anterior boundary, coronary sinus forms the posterior boundary, tendon of terror forms a superior boundary, and limbus fossa ovalis will be seen as we enter into the right atrium, but it is not a boundary of Koch's triangle. Okay, so this is about Koch's triangle. Now talking of Walter Koch, what node did he actually discover? He discovered the Koch's triangle, okay, but what node did he actually discover? That is your question for today. Comment in the comment section. And one another question: which node is called as a Tavara's node? Okay. Thank you guys. Let's meet you in the comment section. Thank you.